Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC examination. I will share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts. Certified Professional Coder, that is CPC exam, evaluates the proficiency in medical coding through 100 multiple choice questions covering 17 key knowledge areas. Model Paper 1, Chapter 3, Compliance and Regulatory. This section will test your knowledge on compliance and regulations which pertain to cover the services covered under Medicare Part A, B, C, and D, applying coding to payment policy, place of service reporting, fraud and abuse, also NCCI edits, NCDs, LCDs, HIPAA, ABNs and RVUs. Chapter 3, Compliance and Regulatory. 3 questions. Question number 1. Which entity offers compliance program guidance to form the basis of a voluntary compliance program for a provider practice? A. Center for Medicare and Medicaid Services, that is CMS. B. American Medical Association, that is AMA. Office for Inspector General, OIG. Office for Civil Rights, OCR. So please pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
If you are preparing for AAPC CPC certification, you have to know all 4 these entities and their functions. So if you take the Centers for Medicare and Medicaid Services, that is CMS, it provides coverage for people over the age of 65, blind or disabled individuals, and people with permanent kidney failure or end-stage renal disease. Same as AMA, American Medical Association, is a professional organization representing physicians and medical students, advocating for their interest and promoting public health. It works to improve the art and science of medicine through policy advocacy, education, research, and physician support. Also, CPT Code Book is a registered trademark of the American Medical Association and its largest single source of income. If you see the OIG, that is Office of Inspector General, is engaged in activities to test the efficiency and economy of government programs to include investigation of suspected healthcare fraud or abuse. The Office of Inspector General, OIG, has provided compliance program guidance. This guidance can be used to form the basis of a voluntary compliance program for a physician practice. So if you read the question, which entity offer compliance program guidance to form the basis of voluntary compliance program for the provider practice? So it is obviously the Office of Inspector General. So for additional knowledge, what is OCR, Office for Civil Rights? The US Department of Human and Health Services Office for Civil Rights, that is OCR, enforces federal civil rights laws, conscience and religious freedom laws, HIPAA privacy, security and breach notification rules, and Patient Safety Act. OCR's primary function is to ensure equal access to opportunity for individuals in HHS funded programs and services. OCR also investigates and resolves complaints of discrimination, ensures compliance and civil rights laws, and promotes fairness and equity. So for this question, the correct answer is C, but you have to know the all 4 entities and their functions. Question number 2, the full description of CPT code 24925 is, so there are 4 answers. Please pause the video and look into your CPT code book and answer this question.
5, 4, 3, 2, 1.
In the CPD book, there are 2 types of description. One is common, other one is unique. The common portion of the description follows the code and end with semicolon. You can see this one, 24900. You can see amputation arm through humerus and is followed by semicolon. So this part is common for all other items that are coming underneath. So any CPT that share that description is intended beneath the code. Any portion of the description following the semicolon is the unique portion of the descriptor and only belongs to the single code. For example, for this 24900, this with primary closure is belong to this one. 920 open and circular belongs to this one. Like that is go. In the case of code 24900 contains common description, that is amputation arm through humerus, and codes 24920 through 24931 share the part of the description and so are intended beneath it with their unique portion of the description beside them. So the answer is C, that is amputation arm through humerus, secondary closure or scar revision. Question number 3 of chapter 3. Which one of the following is a commercial or private payer? A. Blue Cross Blue Shield, B. Medicare, C. Medicaid, D. Veterans Health Administration, that is VHA. So please pause the video for a few seconds and think the answer.
3, 2, 1.
You already know that there are government and private or commercial payers. So if you take government payers, there are main two payers are available, Medicare and Medicaid. The Medicare is the most significant government insurer. Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid Services. Second one is Medicaid. Medicaid is a health insurance assistance program for some low-income people, especially children and pregnant women, sponsored by the federal and state governments. Similarly, Children's Health Insurance Programs, that is CHIP, provides health coverage for children. Additionally, the Veterans Health Administration, that is VHA, and TRICARE for military personnel and their families are also government-funded healthcare programs. So if you take the private or commercial payers, so other than this four, you can consider other payers as the commercial payers. The commercial payers, also known as the private health insurance companies, are the major source of health coverage in US, covering approximately 67% of the population. Most renowned companies are Blue Cross Blue Shield, United Healthcare, United Health Fund, Aetna, Humana, Golden Rule. So there are so many private payers are available. For this question, you can get the answer A, that is Blue Cross Blue Shield. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel, and if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.